G'day everyone, back again to talk a little bit more about some facial muscles that may go under the radar because, as I said, I'm all about muscles that go under the radar. Today we're going to talk a little bit about the frontalis muscle, which is just through this area here. Interesting muscle because it's a muscle that is responsible for raising our eyebrows. And in terms of talking about having pain in and around the forehead, it's certainly a muscle that we need to be looking at. We need to make sure that we're not going under the radar. And why it's so important is, well, especially because I wear glasses and I am definitely had this before, and I've certainly had this in clinic myself. Those people who wear glasses and then pop them above their forehead, and obviously they go to bend down, they raise their eyebrows to try and keep the glasses up there. And if you do that for a sustained amount of time, chances are that you can develop a nice little trigger point in this muscle here, this frontalis muscle. Interesting muscle because obviously what it does is it comes down here and it sort of blends into a tissue called the galea aponeurotic muscle, which obviously covers the vertex, which is sort of the top of the head and so forth. And that tissue, you know, sort of glides over the periosteum, which is the outer lining of the scalp itself, because there's not much tissue there, as you can well imagine. And it comes down and interdigitates obviously into the orbicularis occuli muscle, which is the muscle that wraps around your eye. Very important muscle. So what can happen is you can develop a trigger point just above the eyebrow. So if you come the midline up here, come laterally, and obviously about 2 finger widths up, it's in that area where you can develop that trigger point. Now what will happen is it only locally refers in that area. It doesn't refer to the top of your head or out to the side or down into your nose or anything. It's just a local referral. So if you've got clients coming in and they're obviously complaining about, you know, forehead sort of, you know, type headaches, it is a muscle you want to investigate, this frontalis muscle, and it won't be hard to obviously assess it because obviously all you're doing here is just palpating this tissue, and as I said before, you're pushing the tissue up against the bone. So just move it around in a circular motion and up and down and try and pick up that trigger point if it's there. And if it reproduces some of the symptoms they have, then there's a fair chance it's the frontalis muscle that's causing this issue. And in terms of treatment, it's very easy. I mean, obviously you just want some digital ischemic pressures, okay, pressing into the scalp, just moving it around. I tend to like to move it laterally, so I'll work across the tissue this way, and then obviously just some sustained pressures with some circular motions, not difficult at all. Once again, if it reproduces their symptoms, then there's a fair chance it's the frontalis muscle. And look, it can coexist with other muscles. Obviously, we've got our splenius muscles that refer up into our head. We've got our sternocleidomastoid muscles. You know, we've got suboccipitals in the back here as well. Sometimes the jaw muscles can refer up into the head as well. We can get some really funky referrals. So, but keep in mind, frontalis muscle, okay, as I said, comes down here. Obviously, if you're wearing glasses above your eyebrows, you're looking around, obviously down, and you're trying to hold the glasses up with your eyebrows, really important that you investigate that frontalis muscle, all right? Hope you guys enjoyed it. It's all fun looking for these muscles that go under the radar, but next time you're in and around this area and you're dealing with clients with potentially muscle tension headaches or forehead type pain, check out frontalis. All right, guys, just be awesome at what you do. See you next time.